is Rose and Manzano from BSN 1B. In this video, I will show you how to assess the chest. In doing these skills, you need to perform hand hygiene first and provide privacy to the patient and tell them what you will be doing. We're going to inspect the chest and we're looking for any abnormalities and also inspecting the patient effort to breathe. Now we're looking for the anterior view and this is the posterior view. Now what we're going to do is we're going to listen the heart and the lung sound. So first, let's auscultate the heart. We're going to do this in 5 locations. And they're based on where the valves are located. To remember the mnemonic, all patients effectively take medicine. The first letter of each word represents the valve, except for the effectively. So A would be the aortic, and P is for pulmonic, E is for the Herb's point, and the tricuspid and mitral valve. Using the stethoscope, we're going to listen at the right of the sternal border at the second intercostal space, and that's what we call the aortic valve. And to find the second intercostal space, find the sternal notch. This is the sternal notch, and going down to the angle of Lewis, and then just go a little bit down to the right, and you are in the second intercostal space, and this will be your aortic valve. And now we're just listening to the sound, the labzab, the S1 and S2. And S2, the dub is going to be louder in this location. Then we're going to the left sternal border at the second intercostal space, which is the pulmonic valve. So here is the pulmonic valve, and we're gonna listen again at the labzab sound. Then we're going a little bit down to the third intercostal space, and this is the Herb's point. And again, we're listening to the labzab. Then there's no specific valve here. Then going to the fourth intercostal space, and this is where is the tricuspid valve is located. And lab is going to be the loudest at this location. Then we're going to the fifth intercostal space in the mid-clavicular line, and we're going to listen to the mitral valve, which is the mitral valve is located here. So we're gonna listen to the heart sounds. And again, S1 is going to be the loudest here, and this is the point of maximal impulse, and you're going to listen for the apical pulse. We're gonna count it for 1 full minute, and the normal apical pulse of an adult is 60 to 100 per minute. Now we're going to the lung sound. When you're listening to the lung sound, you're listening for abnormality sound. Here are the samples of some abnormality sounds that you may hear.
Crackles, wheezes, a friction rub, or stridor.
Using the stethoscope, we're gonna start at the apex of the lungs, and we're gonna always compare the both sides and enter the way downward and assess all the lobes of the left and the right lobes. So this is the apex, and first let's start up here and take a deep breath. Then another one. Okay, and this is going to help us to assess the right and the upper lobe. So take a deep breath again. So another one. Then we're gonna go down to the fourth intercostal space, and we're going to assess our right and left upper lobe. So this is the left upper lobe. Take a deep breath. And this is the right upper lip. Take another deep breath. Yeah. Okay. Remember, right lung has 3 lobes while left lung has 2 lobes. And now let's listen to the left upper lobe. Another. Side. Another. Again, using the stethoscope, you're going to start listening at the apex. And one thing to keep in your mind, when you're listening back here, you have the scapula, and you're going to listen between the scapula and the spine, and go down in these regions. And again, we're going to compare both sides. Then we're going to find C7, which is the vertebral prominence. It is the big ball right here. So that's here. So take a deep breath. Another one. Another. Another. And go down about the T3, and you'll be between the shoulder blades, and go a little bit between the shoulder blades and the spine, right in there, and you can access the right and the upper lobe. So take a deep breath. Another one. Then from T3 to T10, we're just going to reach around, and we're going to listen to the right and left lower lobe. So breath. Another one. Okay, and that's how you assess the chest. Thank you for watching.